What if the pill you took this morning was slowly damaging your heart? Not a drug you bought on the street. Not something illegal. A regular pill. The kind sitting in your medicine cabinet right now. The kind your doctor prescribed or you grabbed at the pharmacy without a second thought. Here's what no one tells you. After 60, your body processes medication differently. And some of the most common pills taken by older adults for pain, sleep, colds, hormones have been quietly linked to heart attacks and strokes. Today, I'm going to name them. All 5. And I'm going to tell you exactly what to do about it. Stay with me, because one of these might already be in your home. This topic matters more than most people realize. Heart disease is the #1 killer in adults over 60. But what surprises my patients every single time is this. The risk isn't always from bad habits or bad genetics. Sometimes it's from the medicine cabinet. In this video, you'll learn which 5 types of commonly prescribed or over-the-counter medications are raising red flags among cardiologists. You'll understand why aging changes the way your body handles these drugs. You'll get clear, practical steps you can take this week. And you'll know exactly what questions to ask your doctor at your next appointment. My name is Dr. Isabel Greer. I've been a cardiovascular medicine specialist for over a decade. I've worked with hundreds of patients, men and women over 60, who came to me after a preventable cardiac event. People who are doing everything right, eating well, walking every day, staying positive, and still ended up in the hospital. When we looked at the full picture, medications were often part of the problem. Not the only cause, but a contributing factor that nobody had caught. That's why I'm here, to close that gap. Before we go further, everything I share today is for educational purposes only. This video does not replace a consultation with your personal physician. Do not stop or change any medication without talking to your doctor first. What I'm giving you is knowledge, so you can have better, more informed conversations with your healthcare team. Now, let's get into it. Let's start with the most common one. You wake up with knee pain. Your lower back is stiff. Your shoulders ache from years of work. So you reach for ibuprofen, or naproxen, maybe diclofenac. These are NSAIDs, non-steroidal anti-inflammatory drugs. They're easy to find. You don't even need a prescription for most of them. And they work. I get it. But here's what the label doesn't tell you. NSAIDs don't just block pain. They also affect your blood vessels. They cause your body to hold on to fluid. They can raise your blood pressure. And they make your blood more likely to clot, which is exactly what you don't want if your arteries are already a little stiff from age. Think of your blood vessels like a garden hose. At 40, that hose is flexible. It can handle some extra pressure without a problem. At 70, it's stiffer. It's been stretched and used for decades. Add a medication that increases pressure inside that hose, and you're asking for trouble. I had a patient, let's call her Dorothy. She was 71, fit, still gardening every day. She started taking naproxen twice daily for hip arthritis. 3 months later, she noticed she was more tired than usual. A little puffy around the ankles. She assumed it was just getting older. It wasn't. Her blood pressure had gone up 12 points. She hadn't changed her diet. She hadn't changed her lifestyle. The only change was the naproxen. We switched her to a topical anti-inflammatory gel, applied directly to the joint instead of swallowing a pill, and added some gentle physical therapy. Her blood pressure came back down. The swelling cleared. The lesson? The route of delivery matters. Topical NSAIDs give you local relief with far less impact on your whole cardiovascular system. What you can do, if you rely on NSAIDs regularly, talk to your doctor about the lowest effective dose, shorter duration, or topical alternatives. Don't just keep refilling the bottle without asking why. And stay with me, the next one surprises almost everyone. Sleep gets harder as we age. I hear this from patients all the time. You fall asleep fine, but then 2 a.m. hits and your mind starts racing. So your doctor prescribes something to help. Maybe a benzodiazepine like Valium or Ativan. Maybe a Z-drug like Ambien. They work. At first. But here's what's happening underneath. These medications slow down your central nervous system. That includes your brain and your heart. They can drop your blood pressure too much at night. They can cause irregular breathing while you sleep. In some studies, long-term use in older adults has been associated with arrhythmias, irregular heart rhythms, and a higher risk of falling. Falling might not sound like a heart problem, but a fall at 74 that leads to a broken hip, hospitalization, and weeks of bed rest, that puts enormous strain on a heart that's already working hard. Let me tell you about Margaret. She was 77 when she started taking a sleep aid after losing her husband. She felt foggy every morning, but thought that was just grief. One night, she got up to use the bathroom, felt dizzy, and went down. Hip fracture, surgery, recovery. A year later, she was still not back to her old self. The sleep medication lowered her nighttime blood pressure too aggressively. Her body couldn't compensate fast enough when she stood up. Here's the good news. Sleep can often be improved without medication. Cognitive behavioral therapy for insomnia, called CBTI, has solid research behind it and no side effects. A cool, dark room, a consistent bedtime, no screens for an hour before sleep. These aren't myths. They're clinically supported strategies. Magnesium glycinate, under your doctor's supervision, can help relax the nervous system naturally. What you can do, if you've been on a sleep aid for more than a few months, ask your doctor about a supervised taper and behavioral alternatives. Your heart will thank you. You get a stuffy nose. You're miserable. You walk into the pharmacy, grab a box of something familiar, and within an hour you can breathe again. But if you're over 60, that box might be causing a serious problem. Decongestants, medications containing pseudoephedrine or phenylephrine, work by constricting blood vessels. That's what shrinks the swollen tissue in your nose. The problem is they don't only constrict vessels in your nose. They constrict blood vessels throughout your entire body. Blood pressure climbs. Heart rate increases. Your cardiovascular system gets a sudden jolt of stress. For someone with flexible, healthy arteries, that spike might be tolerable. For someone with any plaque buildup, borderline hypertension, or stiff arteries, which describes most adults over 65, that jolt can tip the scales in a dangerous direction. I've seen patients with beautifully controlled blood pressure come in after a bad episode, and the only change was a cold remedy they took for 3 days. They thought, it's just a cold pill. The cardiovascular system doesn't care what aisle it came from. Safer options exist. Saline nasal sprays, steam inhalation, humidifiers, antihistamines that don't affect blood pressure. These aren't as dramatic as a decongestant, but they don't carry the cardiac risk either. What you can do, read labels. If you see pseudoephedrine or phenylephrine on the box, put it back. Ask the pharmacist for a heart-safe alternative. This is especially important if you have any history of high blood pressure or heart disease. We're halfway through. The next 2 might be the most important ones for your specific situation. This one is for the women watching. But men, don't tune out. This affects the women in your life. Hormone replacement therapy, HRT, has genuinely helped millions of women manage the symptoms of menopause. Hot flashes, sleep disruption, mood changes, bone loss. The benefits are real. But here is something that large clinical trials have shown clearly. The timing of when you start HRT matters enormously. Women who begin hormone therapy close to the onset of menopause, typically in their late 40s or early 50s, appear to have a different risk profile than women who start much later. For women over 60 or more than 10 years past menopause, the data shows a higher risk of blood clots and stroke. Why? Because estrogen influences the clotting system. It makes blood slightly stickier. In a younger woman with flexible, healthy arteries, that's usually manageable. In a woman whose arteries have already been aging for 10 or 15 years post-menopause, that same effect can tip the balance. There's another layer here. How you take the hormone matters too. Research suggests that transdermal delivery, meaning patches or gels applied to the skin, may carry a lower clot risk than oral pills. The liver processes oral estrogen in a way that amplifies the clotting effect. Transdermal bypasses that. I'm not saying HRT is wrong. For many women, it's the right choice. What I'm saying is, if you started HRT years ago and have never revisited whether it still makes sense for you today, that conversation is overdue. What you can do, If you're over 65 and on hormone therapy, schedule a review with your doctor. Ask specifically about your current cardiovascular risk, whether the dose is still appropriate, and whether transdermal might be a better option than oral. This last category is one that I find many of my older patients are genuinely surprised by. Stimulant medications prescribed for attention difficulties, fatigue, or even certain weight loss programs are being used by more adults over 60 than ever before. And while they can be appropriate in some cases, the cardiovascular load they create deserves serious attention. Stimulants increase your heart rate. They raise blood pressure. They activate what we call the sympathetic nervous system, your fight or flight response. In a healthy 35-year-old, the body handles that activation and recovers quickly. In a 70-year-old with any degree of coronary plaque, even plaque that hasn't caused any symptoms yet, that extra demand on the heart can push things over the edge. Think of it like this. Imagine a highway that's already 80% congested. Traffic is still moving, but it's slow. Now a stimulant is like pouring 20 more cars onto that highway at once. It doesn't take much to cause a complete jam. I treated a patient. Let's call him Robert. I know I said this video is also for women, but heart disease doesn't discriminate. Robert was 72, sharp as a tack, recently prescribed a stimulant for attention issues. He exercised regularly, didn't smoke, watched his diet. By every standard measure, he looked fine on paper. But 3 months in, he started getting chest tightness during his morning walks. A stress test revealed a significant blockage we hadn't known was there. The stimulant wasn't the cause of the blockage, but it was increasing oxygen demand on a heart that couldn't fully meet it. We adjusted the approach. His symptoms resolved, but we caught it. What you can do, if you or someone you love is over 60 and taking any stimulant medication, whether for focus, fatigue, or weight, make sure a cardiologist has evaluated your cardiovascular risk first. A simple stress test can provide critical information. Why aging changes everything about medication. Here's something I want you to really understand, because it changes how you think about every pill you take. At 40, your arteries expand and flex with every heartbeat. At 70, they're stiffer. The margin for added pressure is much smaller. Your kidneys, which clear medications from your bloodstream, also lose filtering capacity with age. That means drugs stay in your system longer, and their effects can be amplified in ways your doctor may not have anticipated when they first prescribed the dose 10 years ago. And then there's polypharmacy. That's the medical term for taking multiple medications at once. The average adult over 65 is on 4 to 8 prescription drugs daily. Each one might be perfectly appropriate on its own. Together, they can interact in ways that no single prescription was designed for. I think about a patient who is on a blood pressure medication, a daily NSAID for arthritis, a sleep aid at night, and a decongestant during allergy season. Individually, each had a reason. Together, fluid retention from the NSAID, blood pressure spikes from the decongestant, overnight pressure drops from the sleep medication. Her cardiovascular system was yo-yoing constantly, adjusting, compensating, straining. One particularly hot afternoon, she got dehydrated. Her blood thickened slightly. The swings in pressure were bigger than usual. She had a small stroke. Was it one drug? No, it was the cumulative load. That's what I want you to take away from today. Your body often whispers before it screams. Watch for these signs, especially if they appeared after starting or increasing a medication. Ankle swelling that wasn't there before. Sudden weight gain of 2 to 5 pounds in just a few days. Shortness of breath climbing stairs. More frequent headaches. Heart palpitations, that fluttery or racing feeling in your chest. Dizziness when you stand up. Blood pressure readings creeping higher than usual. These are not things to attribute to just getting older without checking. If they appeared alongside a medication change, there may be a connection worth investigating. Myth: if it's prescribed, it's completely safe. No medication is without risk. Safety depends on age, dose, duration, and your unique body. Myth: over-the-counter means harmless. Some of the most cardiovascularly disruptive medications are available without a prescription. Myth: I've taken it for years with no problem, so I'm fine. Your body at 72 is not the same as your body at 62. Risk accumulates. What your system tolerated then may be straining it now. Here's something concrete you can do right now. Step 1. Gather every medication you take, prescription, over-the-counter, vitamins, supplements. Put them all on the table at once. Most people have never done this. Step 2. For each one, write down, why am I taking this? How long have I been on it? Who prescribed it? Step 3. Ask these 5 questions for each medication. Does it raise blood pressure? Does it cause fluid retention? Does it affect clotting? Does it affect heart rhythm? Is it still necessary given my age and current health? Step 4. Track your blood pressure at home for 7 consecutive days, morning and evening. Write the numbers down. Notice patterns. Step 5. Book a medication review with your primary care doctor, not just a refill, a review. There is a difference. Let's run through this quickly. NSAIDs, common pain relievers that raise blood pressure and cause fluid retention, especially with daily use sleep medications, can lower blood pressure too much overnight and increase fall risk decongestants, constrict blood vessels throughout the body, not just in your nose. Hormone therapy, timing, and delivery method matter significantly for cardiovascular risk over 60. Stimulants increase heart rate and blood pressure, which can overload a heart with hidden plaque. None of these are automatically bad, but all of them need to be reassessed regularly as you age. Your heart beats 100,000 times every day. It never gets a day off. The least we can do is not make its job harder than it needs to be. If this video helped you, share it with someone you care about. A friend, a sister, your spouse. You never know whose life you might help protect. And if you want to stay informed on topics like this, real conversations about heart health for people over 60, subscribe so you don't miss what's coming next. Prevention at 60 is always easier than recovery at 75. The heart you take care of today is the one that carries you to the moments that matter, time with your grandchildren, that trip you've been planning, your morning walks, your independence. You deserve to know what's going into your body, and you deserve a doctor who takes the time to explain it. Take care of your heart. It's the only one you've got. I'll see you in the next video.